I thank you. And there's more than just one of us that have become your champion. So thanks for the shout out.
Yeah, you're welcome. So we can start whenever you want. Just give it maybe a 5:32, 5:33 if you want.
Okay. Yeah, you just tell me and we'll go. I know it's odd for people to have a doctor who's on time too, and that's something I try to do.
Yeah. One of the things that always comes up, so I said people are always asking me about their sleep, and I know that people ask you probably about the overall health, but weight comes up because that's you're obesity medicine certified. So one of the things that we see in our practice at Valley Sleep Center, by the way, welcome Valley Sleep Center people and Activated Health people, because I know they got a newsletter and they're probably here. Something that comes up a lot is obesity. A lot of our patients have obesity as a problem, and they're coming to us because, they're finally going to get their sleep apnea fixed. But my question is, what comes first? Like the sleep apnea or the weight, or do we even know? And you don't even have to answer that now, but like maybe at the end of the call, you could talk a little bit about that because I know my sister, and I'm Melanie, if you're on here, you know Melanie. Mm-hmm. That girl has struggled with her weight, and I have pounded it into her that you have sleep apnea. And she got her tonsils out, and she still had sleep apnea. So I think my sister has finally, sorry, Melanie, I'm like breaking HIPAA here, but I think she's okay with it. But the thing is like, you can't lose weight if you don't treat your sleep apnea. So anyway, I'll let you talk. You be the expert, but there's time.
I think it's a great point for us to end on because I really do. Because I have some statistics that I think will. I'm not a numbers girl, but this is some numbers that I thought I'll share with everybody. So welcome everybody. Yeah, I'll go ahead and share my screen and kind of give you a bird's eye view of what I feel is the connection between sleep and obesity or weight. Can you see everything, Lori? Give me a thumbs up.
Yeah, it looks great. Perfect.
Awesome. Okay. I picked water because it's calming. And if none of you know or you don't know how Lori does like yoga nidra and all that, water is very calming, sounds, rain. And so I thought it would be perfect to have this picture up for us as we are kind of talking through this. So I've just got a few slides because I wanted to open it up, of course, to questions at the end and just a discussion because sometimes we gloss over, especially in the evening when we're given too many facts and figures. So poor sleep is related to a lot of issues. So when someone comes into the office and has uncontrolled blood pressure, I always look for sleep apnea. It's amazing how we can get their blood pressure under control if we get the sleep apnea uncontrolled. So that's always one of my things. When someone talks about uncontrolled, now I'm on third or fourth medication to control my blood pressure, I look for sleep apnea as well as other issues. So we're all connected, right? There's a cardiovascular risk increase when we have poor sleep. Especially heart attack and stroke. So that's why it matters. We want to look through this. Behavior issues. So when we have a release in dopamine, we can have mood changes and we can have behavior outbreaks. So, and then cognitive issues. I just talked about mood. There's concentration. So those are tied into our sleep. Cancer. So those who don't have wonderful sleep, the 3 top cancers that are related to poor sleep are breast cancer, prostate cancer, and colorectal cancer. There's a clear indication that with poor sleep, you're at a higher incident or higher risk of these types of cancers. And then my goal here to talk the most about tonight is obesity. Poor sleep is related to weight gain. And so our metabolism is very complex. And there's a lot of modifiers that we can control. And so sleep, here we go again, connecting the dots. Sleep is a modifier that we can control to help our metabolism out. The hours of sleep that we get make a huge difference. The key number is between 6 and 8 hours. So when we sleep less than 6 hours, you're more likely to have some weight issues. If you sleep more than 8 hours, again, you're likely to have some weight issues. Food intake makes a huge difference on our metabolism and how we sleep. Going to bed on a full stomach is not the best thing to do. If you haven't heard of nutrigenomics, that is eating nutrition to enhance gene expression. So great word for you to look up if you've never heard of it, but that our genetic expression does make a difference to help our metabolism, and it's tied to our sleep. Water intake, super important for our metabolism. I like to think of water as helping the dump trucks get through the body to pick up the trash and get it out of the body. So water is really important. Stress can affect our metabolism. I put it in there twice because of how much it affects. And given what we're going through right now, I'm seeing a lot of sleep issues. Because I'm seeing a lot of sleep issues, I'm seeing a lot of weight issues. So again, it's like, which came first, chicken or the egg? And activity, exercise can help our metabolism. Medications, we're talking sleep here tonight. How many of you are taking Benadryl or NyQuil or Tylenol PM right now because you're trying to help your sleep? Well, I'm here to tell you that Benadryl has been known to increase weight, so we don't want to be using it. There are medications that are related to weight gain and disrupting our metabolism. And then work hours. So there's a relationship between swing shift and night shift. Especially as we get into our third and fourth and fifth decade of life. So it's actually important as you reach those decades to kind of think about, is the swing shift worth the extra few bucks an hour? You know, there's a risk and a benefit there that you have to weigh in with, but our work hours make a huge difference on our metabolism and whether or not we are predisposed for weight gain. So again, why is sleep important, especially in obesity? When we sleep, DNA repair is happening. We have to go into REM sleep. We need our deep sleep for our body to repair, especially our brain, our neurotransmitters. It's super important for us to get sleep. Our hormone reset. Last week we kind of talked about testosterone and progesterone and all of those types of hormones. Well, there are other hormones. We know about leptin and ghrelin. Leptin you want around. It helps us lose weight. Ghrelin, you just think of someone going, grrr, it's your hunger hormone. It's the one that increases, that makes you hungry. And so those are controlled depending on our sleep, how well we slept. Cortisol, again, another important hormone that is important in weight loss. And so oh, I don't know how to get that off of my screen. I don't know if you can see that, the poll or not, but it's in the middle of my screen. So cortisol, important for weight loss. It can actually make us, higher cortisol makes us more reluctant to weight loss. Insulin is also reset by sleep. If you're not getting great sleep, you'll have higher insulin levels. If you've heard of insulin resistance, that is very common for weight gain. So we want to control our insulin levels. Talked about neuroendocrine function. There's an axis called our hypothalamic kind of pituitary adrenal axis. Controls a lot of the hormones I'm talking about. So we need sleep for that function to happen. Fatty acid metabolism is tied to our sleep. Inflammation. It is so, I would say, I probably saw 3 Facebook pages today that had the importance of melatonin because the word is out. Right now, melatonin, we know, reduces inflammation. It helps with reducing the cytokine storm. And so we need this system to be intact to decrease effects of what's happening on our DNA. And then our circadian rhythm is also, we need to keep that in check. So going to bed around the same time, waking up around the same time makes a huge difference.
Were you able to close the window, Melody? Sorry to interrupt.
Oh, no, it's okay. It's so, oh, you know,
Just be able to close it at the red box.
Let me see. This part?
Mm-hmm.
There.
Yeah, did that work?
I think so.
Okay. I just want to be able to see your slides.
All right, so good. We're good there. Let's see. So I think one of my slides, I might have just erased it on accident. Well, if we did, I'm finished. So I might have when I transferred them over, but
Can you see the sleep disorders?
yeah, so I can see that part, but that's okay. So sleep disorders, definitely something I think about with my patients who are having trouble with weight loss. That's why I love referring patients over to Valley Sleep Center, because they see a sleep specialist. They can see a sleep specialist and then undergo a sleep study. So yes, first thing on my radar is sleep apnea. But there are so many other things that can happen, like restless leg syndrome and different types of insomnia. And so sleep disorders are related to difficulty in losing weight. And so I do go looking in that direction when people come to me and say, I'm having trouble with weight loss. So because I'm comprehensive, I go over so many things, medications and lifestyle and nutrition. But one of the biggest things we talk about is how good is your sleep? What is your sleep quality? Do you feel rested? And depending on their answers depends on whether or not they are going to, have a visit at Valley Sleep Center for some testing. And I actually send people over to learn how to have better sleep. So just because you don't have sleep apnea doesn't mean that we don't have things that we can do in order to help our sleep out. So with that, I'll stop sharing and we can have a discussion.
So one of the things that's different about Valley Sleep Center than, some of our other competitors in the Valley is that we are comprehensive. So we take care of all sleep disorders. We even have a sleep psychologist on staff. So if you just can't sleep, like she said, you have insomnia, we have other ways that we can take care of that. And that also can help with the CBTI, which is what Dr. Froese specializes in, can also really help patients with their eating and habits and things like that. So go ahead and ask questions in the chat, or I'm sorry I interrupted. I wanted to do a poll so bad and I finally figured it out, but I didn't know it was going to flash in your slides. But I did ask, as you can see, how many people take Benadryl or Tylenol PM. So if you haven't answered yet, right now 5% of the people do not take it. No one's claiming it. So, they closed the window. That's why. Okay, I wonder if I can. Anyway, well, you could raise your hand. Nobody will see it but us. If you want to just raise your hand and say I take it. But anyway, it doesn't matter. I was just curious how many people take it, because it's a lot of people take it, and it's not so good for you, is it?
It's crazy. Yeah. I think that's the biggest thing that people are surprised when I tell them that Benadryl is related to weight gain. They're just like, I thought it was just helping me sleep. And you just don't get into the deep sleep. It's actually one of the medications that can promote weight gain.
Yeah. So what we're finding is that if people, will treat their sleep disorder, whatever it is, it actually helps the pounds start to melt off. And can you talk a little bit about why that happens?
Yeah, so it's really common once I can start helping somebody sleep, how fast or how much faster their weight loss starts. And there is a direct relationship too. So at the beginning when we started to just talk a little bit, we were talking about which came first. Sleep apnea in the US, and you might have better numbers being a sleep center, but what numbers I've kind of gone by is men are more than women. And in the typical population, there's about 25% of men have sleep apnea, about 10% of women have it. When you go across the board and someone who is morbidly obese, and I hate that word, but it's a word that we're getting used to, especially because a third of the population is morbidly obese. And we're seeing 93% of men having sleep apnea and 73% of women having it. So I think that's why I'm so much more of a physician who's looking for it, because I treat obesity. And so for sure, I'm wanting to address sleep apnea so that they will lose weight appropriately, because I will have a hard time helping them lose weight or get the numbers that they want if we're not treating their sleep apnea.
Tell us about morbid obesity. So body mass index is something that you can all just Google, a BMI calculator. So will you tell us what determines morbid obesity versus obesity, and give us some of those numbers.
Yeah, so kind of overweight is when you have a BMI between 25 and 30, and then above 30 can be whether or not you're obese. And I will say this, it's not a perfect system because it does kind of include your weight and your height and your whether you're a male or female. So it's kind of one of the numbers we look at. The biggest thing that I like to look at is your fat percent. So a male should really have a fat percent under about 26% body fat. Really, when I see it above 28%, I really start to get aggressive with them, because we know that as that fat percent goes up, more of the endocrine issues start to happen. With a female, we're allowed to have a little bit more cushion. So we want to be under 32% body fat. That's really important for us as females. So above, I don't know if you've ever heard of skinny fat. It's someone with a normal BMI, but a fat percent above 32% body fat. And that's someone I want to work with too, because we will start doing blood work and realizing that they may have some of the issues that someone with a BMI over 25 would have. So BMI is just one of those vital signs we'd like to look at. Fat percent is a much better indicator for what's going on metabolically in someone.
Will you talk about that fancy scale you have? Because Deborah and I were talking about that. Like, that thing is so cool. Like, that is, I mean, it tells you all these things and all we do is put our feet on it. That is, yeah. I love that thing.
So it's called an impedance scale. It sends like a little micro electrocurrent. You have to be on it barefoot. That's why it's got little metal plates on there. And as it travels through bone and water and muscle and fat, it can give me a reading. And so there are multiple different kinds. I just happen to have a Tanita scale, but it's wonderful because it does tell me those numbers: your fat percent, your total body water, your muscle mass. And I can go from week to week to see where we're making shifts in your body by using it. Of course, it's still a machine. It can sometimes have hiccups, but for the most part, I love using it because it gives my patients a really good idea of what's happening from a week to week or a month to month basis. One of the other ways people do, they might be going to a gym and they get into like what's called like a bod pod, or instead of on their feet, they kind of are grabbing, kind of looks like a joystick for like a race car. That's another kind of impedance scale that they can use, or a DEXA scan. Someone will do it different, just not looking for osteopenia or osteoporosis. They're using a DEXA scan to look for weight related numbers as well. The gold standard is dunking you in water, but most of us don't want to get, into our skivvies and get dunked in water.
Oh, thanks. I found that so encouraging, honestly, to be able to, see the hard work that I've been doing was like paying off. Like did it even give me muscle mass or something? Like,
yeah, we saw muscle increase. Yeah.
That's so cool. All right. Any other questions here? Facebook. Let me just check really quick. Do you want to talk about how you're seeing patients right now and how people get a hold of you?
Yeah.
Yeah, go ahead.
So we have an initial 12-week program for people who want to lose weight with us. And the wonderful thing is your first phone call is with my patient coordinator. Her name is Rebecca. She's awesome. And she'll walk you through the program and how we do it all together. And then you'll come in. I do get a large blood panel on you, depending on how aggressive you want to be and how in depth will be dependent on which blood panel that we do. We'll do an EKG. We'll do your measurements. And we do everything from your meal plan to supplements or medications, as well as exercise regimens. And you're seeing me weekly for the first 12 weeks. And then after that, we decide on how often we want to see each other. And I've got psychologists that I refer to and work with. I have personal trainers. I have health coaches, those who have a lot of dietary restrictions or need to be on an autoimmune diet. I know what that means. So a lot of times people are scared because they don't know what to eat, or they have like this list online and then they're like, I don't know how to lose weight with all of these restrictions. And so that's something that we put together, and we can change from week to week so that you don't feel bored, you don't feel restricted, and so you're successful.
So great. So, you mentioned the autoimmune thing, and I don't know how many people even know this about me, but other than having cancer twice, I've had active rheumatoid arthritis since I was a little girl, and actually it's in remission now. And Dr. Rodarte has helped me keep that in remission, and she's helped me when I've had my biggest flare-ups along with the rheumatologist. So she really knows her stuff. I remember one time I called her, gosh, this is probably 15 years ago. I think I have the flu. And she's like, this sounds like RA flare up. Like, I mean, it was just, she just knows her stuff just by like talking to patients. She's really, really great. And she does telemedicine. Did you mention that?
Oh, yep. So we're doing majority of visits, thank you, as telemedicine right now to keep you safe as well as us safe. And the neat part is I use a platform with a password, so it's safe. We get to still see each other because I think seeing each other face to face is so important. And when I do bring my patients into the office, we have a really nice protocol where we do a pre-screen. You get a squirt of alcohol in your hands. We take your temperature. You're in that room. I space everybody out, so that gives us time to clean in between patients as well. You have to give us a phone call when you show up, so you just don't walk into the center. So we've put a lot of measures in place. So majority telemedicine, telehealth right now, but because everybody loves to get on a scale and get those numbers, we figure out how to space our patients out in order to do that. And what's really nice is we draw our own blood for our patients.
Oh, that's
and it's so hard right now to get an appointment for blood work. So I love that we offer that for our patients as well.
Yeah, and she even coordinated like with my oncologist what she wanted. So we got all our blood work done like at the same time, and I didn't have to go sit in a waiting room full of a gazillion people with the mask on. So it's so great. And even if you just need a primary care provider and you're overall healthy, like men, women, you're doing that, right? I mean, I could just come to you if I, am sick of dealing with the system, right? If you have an HMO and you're tired of dealing with that. But if you have an HSA, you can use your card to go see her. And for me, I have a PPO. So she just gave me the receipt and I submitted my own insurance. So I love it. So great. And they'll cover, you said, last time you said some of the insurances are covering some of
weight
the
loss. And weight loss and hormones.
And
So I tell everybody, like, go ahead and call your insurance company. Sometimes I just have to write a prescription for you to see me or give you a letter of medical necessity, and they're covering part of the visit with seeing me. Yeah, so you bring up excellent points. Thank you.
Great. All right. Activated.health is her website. If anybody right now has one last question, please ask it. Or if you would like someone from Dr. Rodarte's office to call you, just raise your hand. No one will see it but us, and I'll make that happen. And other than that, I just want to say thank you so much for connecting the dots between, because I've always wondered, like, I think this is how this works, but I'm not real sure. And so now we know. We heard it from the educated one.
I thank you so much for giving this platform, because there's more people we can reach. There's definitely a connection.
Yeah, and tell your friends, you guys. We'll be doing more of these, I hope. I hope. All right. Have a great evening, everybody. Thank you, Dr. Rodarte, so much.
Thank you, Lori.
Bye.
Bye.